It's up to you now, James. You can use them.
I'd like to please invite Chris Proctor, the Director of Community Benefit and Business Development, Barton Hospital, to the stage.
Good morning, everybody. I think it's still morning for a few more minutes. Well, when I asked this recipient for information about what he's all about and things that he's done over his career, I got the first box of material Friday afternoon. I got the second box Saturday. Got the fourth box of files for this gentleman on Sunday. So I've put some things together to talk a little bit about him. But it's a real honor to be here today to share some of those thoughts with you all. I started working with Dr. Clint Purvance about 15 years ago. I've known him for about 20. And if you haven't met him yet, you're missing out on meeting one of the finest individuals you can meet here in Nevada. He's a homegrown Nevadan. He grew up in Las Vegas. He did his medical school at the University of Nevada, Reno. He did his residency at the University of Michigan. We won't hold that against him. And he's been a Douglas County resident for a little over 30 years. He started as an emergency room physician in 1999, working both at Carson Valley Health and also Barton Health. And immediately he brought to the table some ideals about leadership. And I think we've heard a lot about leadership this morning. But when you think about physicians, not all physicians are natural leaders like Clint is. They can be definite leaders in their clinical environment, but when they cross over to what we call the dark side, administration, it can be a real challenge. And so that's been one of his initiatives from day one, is to help physicians truly grow to become leaders. While working at Carson Valley Health, he also helped to establish some real tangible things. He created a new EMS system. He created something called, observational beds that helped better treat patients. And it's this level of service that you're going to hear, throughout my discussion. He also, wanted to provide physicians some leadership opportunities down at Carson Valley Health. That could be taking on medical directorships. It could be taking on leadership of different committees. It could also be sharing their input with all levels of the organization, all the way up to the board of directors. And for physicians, that's not always something that happens. They're not always asked, what their opinion is. Be careful if you ask them, but it's something that is necessary to really establish physician leadership and make them part of your organizational goals. He's also created some initiatives back in 1999 where he helped deliver rural health care to parts of Nevada, like Topaz and Yerington. So we heard, this morning about some of the challenges on mental health locally. There's rural health care is a challenge to this day, and so he was even doing that back, over 30 years ago before I think it was really acknowledged as a real need. Most recently, last few years, he was helpful in the strategic plan for Carson Valley Health's expansion that they opened up earlier this year. So there's a story here, and that's just the kind of the Nevada Carson Valley Health story. If we transition up here to Tahoe, there's a little bit more to this individual. He honed his leadership skills as a medical director for our emergency room here at Barton. And again, it needed to be completely revitalized. You might think that the ED is someplace you don't want to be. Well, for some doctors, they don't want to work in an ED. It's pretty chaotic. And so Clint did a lot of work early on in making himself a better leader, but also helping those physicians become better leaders. And in 2007, he transitioned to our chief medical officer. Even then, he demonstrated this fierce advocacy for quality and safety. And you may not all know this, but healthcare is complex, and every day we strive to diminish the chance of harm. But it happens. And so the one way to really try to draw down harm is to create a very robust quality and safety division. And that's not always something that's led by a physician. It's not always something that's led by a chief medical officer. But Clint took it on, and he not only created one of the best quality and safety divisions in our region, but one that is recognized as one of the best nationally. He also continued his care for creating leadership opportunities for physicians. It's an ongoing process, but he immediately established the idea of creating an environment and a culture where physicians can feel comfortable becoming leaders, helping them know they had a voice, helping them see how they can align with the healthcare system's strategic goals. My leadership opportunity started in 2010 when I had the good fortune of being able to work with Clint as we started to think about how to align our nationally recognized orthopedic surgeons with the goals of the healthcare system. One of the first times I met him in his office, he gave me 3 books. I could quiz him right now and see if he remembers what they were. But one was Good to Great by Jim Collins. If you haven't read that, that's a Bible from me. The other one was Straight A Leadership from Quinn Studer. And then finally, another book that all non-physicians and physicians got for a period of time was Practicing Excellence by Stephen Beeson. Those books are still on my nightstand. I read about 5 pages every night before I fall asleep. That's usually about all I get. But they were kind of foundational for me. So we started working with a group of 8 orthopedic surgeons who thought they knew everything about everything. And it was a lot of late nights where we were working together to try to understand how to get them truly aligned. And this is part of the message here. It's getting alignment. It's getting all the staff, all the team dedicated to one goal. Our second big challenge was in 2012. He started the strategic plan for us to create a first-of-its-kind United States Ski and Snowboard Certified Center of Excellence. So this is a 26,000 square foot center for orthopedics and wellness that became operational a few years later. Again, kind of ground-changing things for a small community hospital. In 2015, he ascended to the role of our chief executive and president at Barton Health. And we saw the same continued drive towards excellence, towards expanding healthcare, towards reaching out to the more underserved in our community. And the mission was really to create strategies and systems that would help our hospital, which is a little over 60 years old, make it for the next 60 years. That's really the goal. So whether it's creating centers of excellence or establishing outpatient services to meet the needs of the community, focusing on safety or quality, he's always been committed to providing that access. And it's really an ongoing exercise. It's not ever a destination. It's definitely a journey. But he's also been committed to growing partnerships. Partnering is a key issue in his world, and it's shared with all of us. Through partnerships, some of the ones we've heard this morning, you're able to solidify the ability to deliver care to all the community. Some examples, are working on our 3-decade relationship with U.S. Ski and Snowboard. Last year, we expanded to be able to be the medical providers for our professional hockey team who call this facility home, the Tahoe Night Monsters. And then more recently, he brought Cleveland Clinic Connected to our region. So for us as a small town, again, it's kind of earth-shattering things that he's helped develop. And all of these really just kind of come back to his commitment, his personal commitment to our mission and our purpose, delivering consistently exceptional care. And that's just not for us as community members, but it's for our visitors as well. But wait, there's more. So at this point, Jeff Prater and I were going to pivot into a roast, but unfortunately, Jeff, he brought his family, so we probably want to do that at a different time. But thanks, Renee. But if you haven't heard, for the last 3 years, he has led the charge in our mission to create a one-of-a-kind, state-of-the-art healthcare facility here at our State Line campus. That hospital is truly going to bring healthcare into the next 60 years plus as we develop it. It'll also better serve our community, better recruit and attract professionals, but it's going to bring services to us that we don't have right now. Oncology, cardiovascular care, so big things, again, for such a small community. Now, I've talked a lot about, Clint's service and his dedication to being a level 5 leader, but I'd be remiss if I didn't talk a little bit about his personal life. If you see him on the weekends, he's just like a lot of us. He's an avid outdoorsman. He's taking advantage of all the things that Tahoe has to offer. But he is one of the most committed people to his family and his faith that I've ever met. He and his wife, Shauna, have raised 4 kids, now adults. It's been a long time, who are already on their journey to being really amazing, exceptional contributors to our community. And that's really what it's all about. I think we heard it from the previous speaker. It's building for the future. And he and Shauna have definitely done that. So I feel incredibly fortunate to work on a daily basis with Clint. I consider him a mentor, and I consider him a friend. And I'd like to welcome Dr. Clint Purvance. Thank you.
Well, it is an honor to be here today and to have this type of a recognition. I certainly was not expecting it, and I don't feel old enough to have this award, but I'm just joking. We all are growing up and growing. As we do grow and we think about the next generation of leaders all throughout the room here, those that are being groomed to take over in leadership, for those that are mentoring and beginning to step aside, we're grateful for those opportunities to be part of that. You know, my family, my wife, I've got to say thank you so much. There's no way I could do what I do every day, which sometimes is stressful, but with friends like Chris is a little easier, and the team from Barton that's here in Carson Valley and partners at Carson Tahoe. That all makes our jobs easier, but without the love and support of my wife and my family, we wouldn't be able to do anything that we do, and certainly I wouldn't, so I'm grateful for that. I want to also just say thank you to the leaders in the room. It is about collaboration. Our mission is to serve. And many of you here that have worked in the community for so many years, you're servants of the community, and that's hard to do. It's hard to do as elected officials or those that are hired in to do various roles in these communities, and it's getting harder. And so I would just encourage you all to find ways to partner, to collaborate, and to come together. Because while we have diversity in opinions, that's not our strength. Our strength is really in the respect we have for one another, and then our unity and purpose as we serve our communities. And with that, I just want to say thank you very much. What an honor.